So, what might you expect to happen in a initial therapy session? It's a really common concern, and I think it probably is something that prevents people from going to therapy is that uncertainty and anxiety about not knowing what to expect. So, that's totally normal. You don't have to have your thoughts formulated. We've been talking a little bit about anxiety in these videos, and part of living with anxiety is that it can be really hard to conceptualize or explain what's happening. We know that. So when you're coming into therapy for the first time, usually what we're doing is listening to understand. We'll ask some questions. Every therapist probably has a different style of doing an initial assessment or intake or interview. But really, what we're all listening for is like, who are you? What's important to you? Starting to get into maybe some of what has happened in your life, what brought you to therapy today, what's different about now than maybe 6 months ago that made you finally decide it was time to get some help. So we will ask the questions. I think that's one thing all therapists are highly skilled at is we know the questions that will bring out some of the information that we're looking for. And that doesn't mean that you're going to feel comfortable or ready to spill every detail about your life with a therapist. We know that. That's totally understandable and totally fair. When you come to therapy for the first time, your nervous system is also evaluating, is this a safe place and a safe person for me to share my inner thoughts and feelings with? Because we know sometimes people haven't had good experiences in therapy. Sometimes people were pressured to go to therapy. It wasn't something that they wanted to do on their own. They didn't have a good rapport or connection with a previous therapist. So, totally understandable and normal that, especially in a first session, a lot of what is happening kind of simultaneously is we're gathering a little bit of get to know you, understanding your story, your experiences, what you're hoping to get out of therapy, while at the same time, our nervous systems are kind of figuring out, is this a good fit? Can I feel safe in this room with this person? Does this feel like somebody that I can build a safe, trusting connection with so they can help me? So you do not have to come into an initial assessment ready to disclose everything that's ever happened. And in fact, I sometimes discourage it because I want to go at a pace that isn't going to be too fast. Even if you want to get better really quickly, your nervous system is going to stop you. So if we go too fast too soon, your nervous system might go, we're not doing this. This does not feel comfortable. So part of that pacing is going to happen between the therapist and the client. And that's okay. And it's okay to say, I don't feel like talking about that yet, or, I'm not ready to answer this question. Therapists understand that we have to work at a pace that's going to feel comfortable for you and your nervous system. And on that note, that is why we do talk a lot about therapeutic fit. And it's not something that's really easy to figure out just by reading websites or bios or getting a referral from a friend. Sometimes good fit is really a combination of a lot of things. There are practical things that you can look for in a therapist. You might know that you want to work with a female, or you might want to work with somebody who's older, or you might want to work with somebody who has experience working with people that have the same mental or have experience working with mental health diagnosis. Like there's lots of practical things you can look for, but I really do believe that sometimes it is that nervous system safety and exchange that's probably more important than anything else. And that can be difficult to find until you're in the same room with somebody and you have that opportunity to really see if there's a good, safe connection. So we are working on something. We are trying to create a app that is going to help make matching more inclusive of a variety of factors that contribute to the therapeutic relationship. So it's currently in development. So we're not quite sure what the final product will look like, but we're really excited to share it with you when it's ready.